Hey everyone! Today we're going to get started talking about the nutrition assessment process and how it works with anthropometrics. So let's start with the nutrition assessment. The RDN plays a critical role in the nutrition assessment and the delivery of healthcare. The RDN is responsible for maintaining good health and quality of life in the patients and clients. The overall purpose is early recognition and treatment of nutritional problems. So here, I really want to highlight, the nutritional problems aspect. The dietitian is critical in the early recognition and treatment of nutritional problems. You'll see that I highlight nutritional. In many patients, they'll have a variety of medical diagnoses and problems, but they may or may not have nutritional problems. And it's the RDN's job to improve the effectiveness of medical treatment and prevent further risk and complications. Just try to get my mouse back. So the registered dietitian provides services to assess, diagnose, and treat. So the nutrition care process is first assessment, then diagnosis, intervention, and finally monitoring and evaluation. And we can think of this as a circle because, especially with nutrition, very rarely do we have an endpoint. Most nutritional problems are ongoing. So here you'll see we have nutrition assessment and then reassessment. We'll get back to that one. We need to obtain and collect timely, appropriate data, analyze and interpret with evidence-based standards, which we'll get into, and of course, document. Next, we have our diagnosis. So based on our assessment, what do we think is going on? Identifying and labeling the nutrition problem, determining the cause and contributing risk factors, clustering signs and symptoms when defining characteristics, and then of course, again, documentation. So we've assessed the patient, we have a diagnosis, now we need an intervention. We need to plan an intervention and formulate goals and determine a plan of action. And this ideally should be done with the patient. And then we need to implement the nutrition intervention, and care will be delivered. And of course, we're going to document that. So it's all well and good to start an intervention, but then we have to monitor and evaluate that intervention. Are they making progress? What measurement indicators are you going to use? How are you going to evaluate these outcomes? And I want you to keep all of these in mind for when we start doing our PES statements, which stands for problem, etiology, and symptoms. When we're doing our PES statements, this is really where we're defining our problem. That's our diagnosis. Our underlying etiology is what's causing it. The signs and symptoms should be things that we note in our assessment. And then our intervention should address the problem. We should monitor and evaluate the same things that we note in our signs and symptoms. So a couple of definitions. The first is nutritional status. This is a measurement of the extent to which the individual's physiologic need for nutrients is being met. We then have a nutritional assessment. This is a systematic approach used to collect, record, and interpret relevant data from patients, clients, family members, caregivers, and other individual groups. And finally, our diagnosis. The diagnosis of a nutrition-related problem.